All of us go through fevers not once or twice, many times throughout our lifetime. When do we start worrying about fever and when do we investigate? I am Dr. Srimathy Venkatesh, practicing in Apollo Hospital, Chennai. We will do a short talk on this question about fever. So, when do we worry and what do we do? So, fevers can be caused by a variety of reasons. It may be because of infection, it may be because of any other problems in the body like malignancy, or it can be a chronic infection. So if we don't find any localizing symptom, for example, any viral fever will present with a throat pain, cold, cough, or any other stomach related issues, or if there are no associated symptoms, for example, malaria will present with chills, urinary infection can present with difficulty in passing urine or pain while passing urine. So there are localizing symptoms which normally accompany the fever, with which your doctor will be able to decide what kind of fever it is. Any fever which is lasting for more than 3 days, high grade fever not coming under control with only symptomatic treatment with paracetamol, requires investigation. So as we go through the common list of fevers that can happen during our lifetime, frequently it is a viral fever. We all went through COVID in the last 3 years, and still probably we will be going through COVID once in a while. Other flus like influenza, AB and all have been doing the circle rounds for many decades now. So common flu and a sinister fever, how do you differentiate is a question. Common flu is usually self-limiting. We call it as a flu-like illness sometimes if there is no high-grade fever but only body pain or headaches and symptoms of upper respiratory infection. All these are manageable with only symptomatic treatment. For example, an antihistamine for the cold and paracetamol for the fever, adequate hydration, and watch. Fever becomes very important and to be taken care of in the elderly and people who are compromised already in health. For example, a person with severe diabetes or blood pressure or other comorbid conditions like a heart disease or heart failure. These are people who have to be very cautious when they get a fever and seek medical attention as early as possible, because these can turn into sinister fevers as time go by. So normally when do we investigate for a fever? If the fever is high grade, not touching normal within 3 days, then we do a battery of tests. What are the common infections that we can go through? As I said, one is viral, the others are bacterial. As we know, fever can be because of a variety of reasons, as I said in the beginning. Your doctor will decide to investigate, and common investigations which are done as an initial screening procedure is a complete blood count, which will give your doctor an indication about what kind of fever it may be. Can it be a viral? Can it be a bacterial infection? Or is it something else at all? Apart from that, as a routine investigation procedure in the beginning, we also look for common infections like malaria, dengue, urinary infections, sometimes blood infections like typhoid. So depending on the localizing signs and symptoms, your doctor will also make your investigations tailor-made to get an answer as to what kind of fever it is and treat you accordingly. From your side, what you should need to take care of is, if you develop anything new, for example, breathlessness, continuous vomiting or diarrhea, dizziness, or chills which is not going away, or if you find any lumps in your body, or if you get a rash, you report to your doctor immediately. And also watch your hydration. Make sure that you eat nutritious food and enough water intake. Follow your doctor's prescription. Make sure that you take your regular medications that you're taking for all the other illnesses that you may have. As I said, fever in the elderly and fever in the immunocompromised individual, for example, people who are taking treatment for cancer, or people who are taking treatment for arthritis with immunosuppressants, all these people need to be very cautious when they get a fever and report to the doctors immediately. Your doctor will initially prescribe symptomatic medications and observe you, and based on your baseline investigations may add a specialized test to find out what your fever is likely to be and treat the fevers accordingly. So, as I said, if you have anything new, for example, normal flu will always be self-limiting. So it will get better by 3 to 4 days, your cold will get better, body pain will get better. You may be left with a little bit of cough, which will also get better within a week. If the symptoms do not disappear, consult your doctor and take further investigations or medications as prescribed by your doctor.